disease epidemic, to me, it is the most existential threat to our country. We now have a healthcare system that's completely broken. We're spending 2 to 3 times what European nations are spending for healthcare. We're spending in our country almost as much as all the countries in the world combined. And yet we have the worst health outcomes. We're going to look at all these chronic diseases and we're going to determine what the causative factor is.
Hi, my name is Dr. Rubin, and we can all agree that the health outcomes of Americans significantly lag behind other wealthy nations. But what I disagree strongly with RFK Jr. on is how we got here. He tends to talk about the root cause as if it's one singular issue like a particular toxin or demonizing public health efforts like immunizations. However, the reality is that it's multifactorial. We live in a society where we don't have universal health care. We're the only wealthy nation in the entire world that does not have universal health care. We have a highly privatized system where there are private equity firms that are buying up smaller private practices. There are these large hospital networks that tend to have a lot of administrative bloat and put a lot of stress and strain on healthcare workers who have to see a ton of patients, high volume with low time, which decreases the quality of care. And there's a lot of inequity. So when you average everything out, you may have some wealthier areas of the country that do fine, but then poorer areas of the country that are doing significantly worse. The environment that we're living in, the EPA is actively rolling back regulations that would normally help keep us healthy. Recently, there was a Biden-era rule that would keep the levels of particulate matter 2.5 micrometers in diameter, or PM 2.5 or less. They're allowing that to be at higher levels now, which that impacts everybody because air pollution, when you have smoke, soot, and dust that are at small enough particles, they can get into your lower airways, diffuse into your bloodstream, and create inflammation chronically that can increase your risk of heart attack, stroke, and premature death. We also have many communities that live in food deserts where they don't have access to high-quality, nutritious foods. There's a lot of toxic stress that's going on when we don't have the ability for universal childcare or paid family leave. So these stressors create inflammation. We have a diet that is relatively unhealthy, that people aren't able to follow the current best available guidance that is really sound. People aren't necessarily going to have time to exercise, and the costs of healthcare keep rising as we have all this administrative bloat because there's not a universal option. So all of these pieces together, including many more, lead to a lot of the problems that we're facing today, and we need to focus on ways to systemically change this in order to improve the health of every American.